So the first thing is to talk about patient safety, and then it's to find your champions, both in surgery, anesthesia, and your frontline nurses, who really think that this is the way to go and to be really a patient advocate.
And just as long as you follow, it's very detailed. You go through each step individually. It's very easy, it's very fast, and you'll notice a big change and how everybody seems to come together, communication increases, and actually the teamwork builds a lot better.
Well, I think the checklist has made tremendous differences in terms of how we work in the operating room. It's on many levels. I think firstly, it's been very important in terms of how it unifies all the OR personnel in the actual operating room theater as important stakeholders in terms of how, who is in the operating room and how each of us play a role within the operating room. It's important particularly for new recruits, medical students, nursing students, junior residents to feel like they're part of the team, and this is one of the opportunities for us to get to know these individuals in the operating room and also allow them to understand what's actually happening in the operating room.
I was in personally yesterday. We had several patients that were not quite ready. We moved ahead to another patient, got bumped for an emergency, and it became essential that the entire team gathered before the surgery, before the patient was asleep, to discuss the procedure, what we were going to use, the equipment we were going to need for the specific patient, and to ensure that the right patient was there.
The differences that have been made by use of the checklist at UHN in this past year are primarily, I think, pertinent to clarity of information and communication among the whole team. It's a brief thing that we have to do. It's not arduous, it's not difficult, it's not taxing in any particular way. It's really just a habit that we have to get used to. And what it does is make sure that everybody in the room is on the same page, up to speed, knows all the relevant details of what we're doing, why we're doing it, and to whom we are doing it.
Don't have experience with this kind of thing, you may be reluctant to participate with at first. And I think I was a little bit reluctant at first, and it really is a valuable thing, improving team spirit in the operating room and allowing people to really perform to their best. So I think it's really brought us together, and it's really been a big improvement.
It's very important that, one, we know the case we're doing, whether the patient has allergies or not. But also, I give a lot of blood products during surgery, and I really want to know if the blood has been crossed and typed. And we have picked up on issues where blood is not ready in the blood bank. So we may delay the surgery until we find that we have blood available for the procedure.
No, the checklist does not take a lot of time. At most, it probably, if your patient is complex, if you really want to discuss what your approach is going to be, it might add an extra 2 to 3 minutes. And in the greater scheme, when you have a patient on the table, an ASA 4 or 5E patient, complex surgery, you're going to be there for the next anything from 5 to 8 hours. I don't think 3 minutes is a lot of time to ensure patient safety.
It's important because I think a lot of preventable problems can be solved by having the discussion up front. The greatest thing about the checklist is that it's so flexible in terms of how you construct it that it could work for any institution.
In terms of the length of time that the checklist takes to perform, it's actually very brief. As I think you'll hear from many, the discipline is getting into the habit, but it really takes only moments to do. It also, however, though actually doing it only takes a few moments, it also encourages discipline prior to the actual checklist to be sure we've got the information in our heads, at our fingertips, for when the checklist is actually carried out.
Oh, if I was having surgery, I would definitely want to have the surgical checklist used.
If I were a patient having surgery, I would prefer if the surgical checklist was used.
If I were a patient, I would want a checklist to be performed for me.
If I was to have surgery, would I like to have a checklist? Definitely.
If I was a patient and I was going to have surgery, I would love to have the checklist list being used. And why? Because I'd like to ensure that the team, they're all on the same page, that they all have the same information and they know exactly what is to be done.